Good morning, everyone. We're so glad to be here with you today. People are gonna be trickling in over the next little bit. My name is Katie Zenger. I'm working with the Alliance on this awesome project for the Community Impact and Action Project. And we are here today to talk about actionable CHNAs, back to basics and best practices. So really excited to get started with everyone today. We'll let folks in. If you just want to go ahead in the chat, we're not going to do it. We're going to get like straight to the content today and do lots of, hopefully y'all have great questions for us and do some interactive exercises and talk through that. So what we'd love is to just put your name and your organization that you're representing in the chat so we can have good attendance from the chat thing. So thank you all so much for being here. Very much looking forward to today. And with that, I'm going to pass it over to Landon and Pam. Pam's going to share her screen and Landon's going to do our intro. Thanks so much, everyone.
All right. Well, good morning, everyone. My name is Landon Campbell, and I am the program manager for the Alliance for a Healthier South Carolina. I just want to thank you all again today for taking the time to join us on our first virtual learning session for our community collaborative. And this one's going to be focused on best practices and basics for your community health needs assessments. We have a lot of great content to cover today, so I'm going to go ahead and get us rolling. Do you mind moving to the next slide? So I'd like to take a moment to introduce our content matter experts for this work. We have Dr. Melissa Fair from the Furman Institute for the Advancement of Community Health and Pam Gillum from the USC Center for Applied Research and Evaluation. Both of our experts bring a wealth of information to the table and are working diligently to continue providing resources within this space. Pam Gillum will be our primary speaker for today's call, and we're also joined, as previously mentioned, by Katie Zenger. She's going to help us to facilitate this virtual learning session and some of those going forward. Next slide, please. So, before I hand it over to our experts today, I'd like to touch on our broader work with the Alliance that is sponsored by the Duke Endowment. Collective Impact and Action aims to support our assessments and planning processes at the state and local levels. So think about your state health assessment, your state health improvement plan, as well as your CHNAs and your CHIPs. We approach this process with 4 complementary objectives. First, we are providing secondary data dashboards alongside the Department of Public Health through the SC Health Compass. These dashboards are based on priority areas from the 2023 State Health Assessment and will compile a long list of indicators that will be useful for action planning, for grant writing, for higher education and research, as well as advocacy. Our second objective covers the CHNA CHIP Collaborative and its associated tools and resources. So today's learning session is the example of this work. Our third is focused on results-based accountability and the training associated with it to improve capacity and action planning to align all of our efforts alongside a common framework. So we have free online modules and in-person workshops to help teach you this framework and have partnered with the South Carolina Office of Rural Health and AHEC to ensure that all of these trainings are effective. The next in-person training is going to be on November 12th, and it will be hosted here in the Upstate. If you would like more information about that training, please contact me after the call, and it'll also be in our follow-up email today. The online modules are asynchronous and can be accessed at any time through the AHEC site. We'll share that link as well. And finally, our fourth objective is what we are doing. We are integrating the Clear Impact Scorecard system to help us track and share the progress on these action plans. This common framework and reporting will allow for a greater crosstalk and alignment between state and local level efforts. And ultimately, our goal is to have all of our community health improvement plans and our state health improvement plan within this system so that you have a very robust overview of what's going on in our state. And with that, I'm going to hand it over to Pam.
Thanks, Landon. Welcome, everyone. I'm so glad you're here today to talk with us about 3 key challenges with conducting CHNAs and best practices to help you address those challenges. Those 3 areas we're going to focus on today is number 1, data collection in conducting CHNAs. Number 2 is how do we collect data that reflects our community demographics, a key challenge we run into in terms of conducting CHNAs. And lastly, how do we engage our communities in data collection for CHNAs? But first, before we jump into this, I'm going to hand it over to Katie so she can help us learn a little bit more about you and where you are in conducting CHNAs. Katie?
Hi, y'all. So these are your instructions. This is our fun, interactive piece for the day. You're going to see a link in the chat as well. You can use this QR code. You're going to go to, or you can go to www.menti.com, MENTI.com, and you enter this code for this meeting. It's 55975170. I feel like I'm on like an infomercial. 55975170, or use the QR code and it'll take you right there. And we will get to learn, where are you in your China chip process? And see if you're working on CHNAs and community health improvement plans, where are you? Haven't even started, or maybe it's not applicable to you yet and you're just here to learn the basics. You might be in the data collection planning phase, the collecting data phase, analyzing data, prioritizing that data, working on your final CHNA report, developing your chip and IDing that strategy for developing that community health improvement plan. And then, or maybe some of you are already implementing your chip. I don't think so with how the calendars are working, but where are you in this process so we can see what's going on with everybody today. Pam, is this what you about expected for folks? It's looking like few haven't started, few are prioritizing, more working on their final report and working on that chip strategy, which is kind of together.
Yeah. Okay, a few more in terms of collecting data. Great. So many of you are working on developing your chips. All right.
But nobody's implementing yet. So, all right. So do we want to go to the next one? We have one more quick question for y'all. Where are you engaging the community? At what point? And it's okay if not at all yet, right? Like we're all, a lot of us are really new to this, and the whole point about this webinar is to make sure you have the most basic, important information you can have. So I'm seeing one. So y'all, the dots will pop up as you let us know, and you can pick more than one. Of course, hopefully you are engaging the community in multiple places. Okay, and data collection, obviously, great. Prioritization. Pam, what do you think is like maybe the most common place that you see folks engaging the community?
I think where the data collection and prioritization is where we often see it happening the most. Yeah.
Yeah. Where would you like to see it more? I know we're previewing a little bit, but where would you like to see it more?
Like thinking about how you engage the community throughout not just the CHNA, but also CHIP implementation.
Ooh, okay, great. Well, yeah, this is going to be up for a little while. I'm going to stop sharing my screen so we can get back to Pam's content, but please feel free, even if you're a little bit behind, to go ahead and enter your answer for either one of these so we can collect that information. Thanks.
Great. So I'm going to go back to sharing my screen. If you'll just give me a second. This is a new area for me that I'm trying to build my strengths in. All right. How do we look, Katie?
Looking good.
Fantastic. All right. We'll keep moving. All right. So just to set a little bit of grounding, it's kind of, you might be curious, like what's going on at the national level. So Melissa Fair and I, who unfortunately, as Landon mentioned, is not able to be with us due to some unforeseen circumstances, and we'll miss her, and I really appreciate her collaboration and expertise on this project. But in phase one, we conducted a landscape assessment report, and part of that was a lit review looking like at what's going on at the national level around CHNAs and CHIPs. and what it looks like for other healthcare systems who are conducting them. And the key takeaway here that we want to message to you is that you are not the only ones. So what we have been learning through talking to several healthcare systems just in South Carolina is it's the same thing that's happening on the national level. So we wanted to share with you some more information on what we're seeing at the national level. So what we do know about CHNAs is that they have a lot of potential to improve health outcomes through the identification of community-driven health needs and priorities, right? But however, the process for conducting them is not standardized. The guidance that's provided by the federal government is not prescriptive, so it gives healthcare systems a lot of latitude in how they're conducted. Well, the challenge of that is that it limits the ability to compare and drive health improvement strategies within states and across regions. What we're seeing is that there's a lot of similarities in how data is collected by healthcare systems. Oftentimes, they're using mixed methods, which means collecting both quantitative and qualitative data, and that many healthcare systems, their priorities now are including non-medical drivers of health. So as part of their prioritization, those complex social needs such as food insecurity, housing instability, transportation are rising to the top as priorities that need to be addressed in the community. And lastly, there's an increased recognition of the importance of the community's voice. There's this shift like from top down to a more bottom up approach in conducting CHNAs. Now, with that being said, there's also a lot of variability in how healthcare systems are engaging the community. So it's kind of like a continuum where it really varies. So community engagement may look like asking community-based organizations to hand out surveys or hang up flyers with QR codes to try to increase response rates on surveys for the CHNA. Or it could be that they have a variety of community members that are serving on a CHNA committee and where they are part of designing the data collection process. Or it could be very much that the CHNA is led by a community coalition, and we've seen that even here in South Carolina. So many healthcare systems are also reporting challenges related to engaging the long term. So you heard me say when Katie asked me, like, where would you like to see more happening in terms of engaging the community? Well, we believe strongly that your community can be super helpful in terms of the implementation of the community health improvement plan. And so what we've found through our landscape assessment and are seeing it happen at the national level, that community engagement typically stops after the CHNA is done or the CHIP is done. And it's really a challenge where healthcare systems struggle in terms of engaging the community during the implementation of the CHIP. So far, there is mixed evidence in terms of CHNAs and CHIP's ability to have a lasting impact. But with that being said, there's some real strengths that have been identified through the CHNA and CHIP process. And so here's 3 of their key strengths. Number 1, they can increase partnerships and resource sharing. Secondly, they've increased community awareness of health and social issues. And third, increases engagement with policy decision makers. So these are some real strengths of CHNA and CHIP processes. This is what we found in the landscape assessment. These were the key findings, not just from our literature review at the national level, but also what we found here in South Carolina. So now we're going to start turning to our primary focus for today, and that's really talking about some best practices for the 3 key CHNA challenges of data collection, collecting data that reflects our community, and also community and stakeholder engagement in the data collection process for CHNAs. Today is really focused on CHNAs. So I'm going to jump in and we're going to start with data collection, but I want you to know if a question pops in your head that you would like us to answer, you can put it in the chat box. And after I present on each each challenge and best practices for that. We're going to have a few minutes of time, and Katie's going to read out some of those questions. If we don't get to your question, don't worry. Melissa and I are going to be working together on creating a Q&A document that will be emailed to everyone after this webinar. All right, let's get started. Katie, did you want to say something?
Just wanted to do a quick note. If there are no stupid questions, but CHNAs and CHIPs can make people feel super overwhelmed. So I just want y'all to know, if you want to text me or like chat me directly, I can ask the question anonymously additionally. So no stupid questions here.
Great, thank you. All right, so let's talk about types of data. So some of the feedback that we got with some of the healthcare systems we've worked with already in South Carolina is it's really nice to be reminded of those words and terms that might be used in data collection. And so I'm just going to do a quick primer of those. Oftentimes you hear the words of primary and secondary data. And so what does that mean? Well, primary data is data that you collect yourself, okay? Secondary data is data that already exists. It's collected by others, but that you can reuse for your CHNA. Examples of primary data sources are surveys, questionnaires, focus groups, and interviews. And then for secondary data, there's examples of surveys also that can be used that might inform your CHNA that you didn't do. Statistics, official statistics and records, reports, journal articles. There's a variety of data, secondary data sources that you can use to inform your community health needs assessment. Okay, so now let's talk about two more terms. Let's talk about quantitative and qualitative data. So when we talk about quantitative data, we're really talking about numbers, things that are measurable. This type of data answers questions for us about how much and how many. Now, when we talk about qualitative data, we're talking about your non-numerical. Those are data that helps you explain the quantitative data. It answers the questions of why or how. It gives you context behind the quantitative data. So both are very useful and very important in terms of conducting CHNAs. Examples of quantitative data is your survey data, test scores, health outcomes data. For qualitative, it's what we hear that might explain the quantitative data through interviews, focus groups, listening sessions, or town halls. So these are examples of quantitative and qualitative data. Now let's put them together. So we wanted to provide some examples to you when we think about how quantitative and qualitative and secondary data and primary data fit together. So secondary data sources that are quantitative in nature, we oftentimes use census data from the American Community Survey. We oftentimes refer to the Robert Wood Johnson Foundation's Community Health Profile, and our very own Department of Public Health is developing a data dashboard in which you'll have access to. It's up and live and going. Hey, Landon, can you remind me what's the name of the data dashboard so we can share it with everyone?
It is South Carolina Health Compass, and I'm about to add the link in the chat in a moment.
Great. Thank you for doing that. And then when we think about secondary data sources that are qualitative in nature, so the Sisters of Charity Foundation just conducted a statewide poverty study, and it was very much qualitative in nature, so that gives you context. There was also our Title V needs assessment that was conducted this year by DPH. There was a lot of interviews and focus groups that were conducted that were part of that needs assessment. And then the South Carolina Chamber of Commerce blueprint for 2035, they just finished going around the state talking to businesses about what they think are most important issues for them. And so that could be a potential secondary data source with qualitative information. And then from a primary data standpoint, meaning data that you would collect yourself, from a quantitative standpoint, many of you conduct surveys. And so there is a survey data bank that's been created that is right now available, and you can actually access it through the Alliance of Healthier South Carolina. Also, your electronic health records, y'all, has a lot of data that you could use that could inform your community health needs assessment. And then here's just another example of a research study I'm involved in around diabetes, type 2 diabetes. That's something that there's data coming from that could be used. And then from a qualitative side standpoint, from a primary data collection, you could go out and conduct focus groups with target populations. And we'll talk more about that in a little bit when we get into ensuring that your data is reflective of your community, interviews with providers and organizations, and then town halls and listening sessions. So one thing I want to note, and I've used this analogy, and I don't know where it came from, y'all. It just like popped in my head and I started using it, but it's like this idea about like a really good banana pudding, right? Like there are so many different recipes for banana pudding and they're all really good. So, but they all might have their own little variations, right? But it's banana pudding. What we're going for here is the blue ribbon banana pudding. And so that's what we're trying to present to you today is a recipe of best practice to make the best CHNA you possibly can. So I say all of this to say, you may not be doing the blue ribbon banana pudding right now with your CHNA, and that's okay. We have to think about resources, staffing, etc. But these are things for you to consider if you're moving into your CHNA or maybe for your CHNA next time. One of the big takeaways that we hope you leave here with today is that you choose your data wisely. Do not collect data on your own. So don't do primary data collection if you can get that data from other sources. That is time saving for you. It helps you to be more efficient if you can access data in other places versus trying to collect it yourself. Thinking about what those other sources could be, your electronic health record is a great place to go access data and understand what are those key conditions, diseases, healthcare challenges in the communities that you serve. You can ask for Medicaid claims data to help you get a sense in certain target populations. There's the healthcare system quality reports, and there may be other organizations in your community that conduct some form of a community health assessment that you could use to help inform your CHNA. We also have the Live Healthy SHA and SHIP that's just been launched. And we also have our academic partners who also collect data that you could talk to and see if they would be willing to share. And last but not least, one of the things that we've heard from healthcare systems across the state is conducting your CHNAs and SHIPs is an area that you really don't compete. So working with your fellow healthcare systems in terms of data collection, if they've already collected data, how could that data be used to inform if you cover the same areas? So cross healthcare system collaboration, we are encouraging. All right, I'm going to talk specifically about surveys and about qualitative data. And so we're going to start with surveys first. This is my big, if anybody remembers the Spice Girls, tell me what you want, what you really want. You know, that song, like surveys. Exactly, Mary, I see you. It's a great song, right? From back in the old days. I love that song just because it makes me think about surveys and development of good surveys. We really need to think about on our surveys, what is it we really, really want to know? And also, we don't want to collect data. I've already said this, but I'm going to say it again. We don't want to collect data in our surveys that we can get elsewhere. Survey fatigue is real, right? Like people are tired of taking surveys. And so we don't want to ask questions that have already been asked recently. Let's access that data. So when we think about survey data collection and the goals of survey data collection, ideally, we want to get exactly what we want the first time. We want to develop a survey that people want to take, right? Which means it should be as short as you can make it. Short and sweet is what we like to say. which is hard, right? But being very thoughtful about what we're asking, because really there are no do-overs in surveys. Once you launch that survey, it's really hard to go back and collect data. So putting the time in into developing a good survey is really important. If you have an academic partner in your community, reach out to them. It could be they have someone who has expertise in survey development. And then also, if there's an existing survey, which there is, don't create a new one. You could reach out to the Alliance for a Healthier South Carolina to access the CHNA survey data bank. And that data bank could be used, and you can pick and choose questions from that data bank to help create your own survey, or use it just as is. So survey questions is kind of an art and a science. Things to consider are, number one, think about the literacy level of your survey respondent. We really recommend that when you write your questions, they're really at a 4th to 7th grade reading level. Questions that might be sensitive or easy, put them at the end. If someone opens up a survey and they start immediately with the demographics, that can be a turnoff. And so ideally you put those at the end of the survey. Forced answers. People don't like to be forced to answer all questions. When I develop surveys, almost always I do them so that they're voluntary to answer, because to me, I'd rather have some data than no data. And then understanding the difference between confidentiality versus anonymity. So confidentiality means you may be getting some data from them that you would be able to identify who that person is, but you may not include that information in a summary report. Anonymity means you're not collecting any kind of demographic data that could help you identify that person, that individual. And so that is what we strongly encourage you to think about is, and most of you, I think, do this already, is you're collecting a little bit of demographic data to give you a sense of, are you collecting data? Are your responses reflecting your demographics in your community? But not enough to really say, oh, I know that Pam Gillum answered this survey. Other things to think about in your survey questions is don't use jargon. If you're using terms that we use in healthcare systems, people might not know what that means, and that can be confusing to them. Double-barreled questions means when you put the word "and" in there and you're asking them about two different things, it might sound similar to you, but someone else may see them very differently. So you want to separate those and make them into two questions. Any leading questions that might influence them to answer a question a certain way. Too many response options. So if you have like a multiple choice question that has 20 different choices, that's too much. Can you narrow it down or combine? And then open-ended questions, y'all. Nobody likes answering surveys with open-ended questions. And also remember, if you ask them open-ended questions, you have to analyze that data. And that can take a while. So I'm not saying don't have open-ended questions, but just be very thoughtful about what you want to know from them in an open-ended question. And then last one thing tip that we have around avoiding is scale choices that don't match questions. So for example, if you're asking them about their level of agreement in terms of around access to parks, like if you wanted to know, is this important to them? And if you write access to parks, well, what do you mean by access to parks? Really what you were probably saying is limited access to parks. And you want to know, do they agree that this is an issue in their community versus just saying access to parks? So these are just some little tips for you in terms of thinking about if you're developing a survey. And last but not least, I would suggest piloting your survey if you can. If you can pilot your survey, that is so great, because that helps you identify questions that might not be clear and not understandable. And I mean, you could go ask some friends to complete it. This shouldn't be too hard. You could ask other peers within your healthcare system to complete it. But trying to get a variety of people to give you some feedback is always helpful. All right, now we're going to talk about qualitative data. So why is qualitative data important? How can it be useful to you as part of your CHNA? Well, number one, it gives you the context. So I mentioned that before. So you collect a lot of numbers, but you don't really have the context behind the numbers. So you can, through qualitative data collection, if you're seeing certain things in your quantitative data that gives you pause, makes you ask questions, you could create some questions and ask them through different qualitative methods. Secondly, it supplements your quantitative data, which I was kind of already getting at. So if you're lacking representation from certain populations, you could do some focus groups with those target populations to help understand what the data might be telling you. And lastly, this is a great way to build relationships with community partners and the community at large. Having them really understand what this process is, why you're doing it, how the information is used can be very, very helpful in the long term. So just a few tips related to qualitative data collection. Again, really take some time, just like you would with survey development, to really think about how you'll use the qualitative data you collect. That's really, really important, even in quantitative data. You don't want to collect data that you're not going to use, right? So really think about, from a qualitative perspective, what it is you want to know and how you're going to use that information to inform your community health needs assessment and identify priorities. So if you are going to conduct qualitative methods, whether it's an interview, focus group, town halls, listening sessions, think about these things as part of those sessions. Number one, don't ask leading questions. Again, we want people to really answer on their own. And that also includes thinking about don't using probes. So when I say probes, for example, I just did a study asking pregnant women what challenges did they run into as it relates to accessing dental care during their pregnancy. And I had a bunch of probes listed, like transportation, cost, insurance, etc. I didn't ask them those. I didn't put those out there until I let them answer the question first. And then if I needed to, get a little bit more because they maybe had not thought about it, then I'll use the probes. Think about remaining neutral in your language that you use, in your body language. Also avoid affirming words or behavior. And that's just so to keep it real neutral on your end. And it also keeps them from thinking you want them to answer questions a certain way. And then the last tip I have for you is be flexible with the script. And what we mean by that is, if an answer to one of your questions that you had further down the page gets answered earlier on through another question, you can skip it. You don't need to ask it again. You'll have gotten your data already. So those are just some tips for qualitative data collection. All right, we're ending this section talking about collecting data, and we're going to go to the Q&A. But after each section, we have a list of resources for you. And so we hope that you find these resources as very helpful and useful to you as you're thinking about your data collection processes. And so you will, again, when these slides are sent out, you'll have access to those resources. All right, Katie, do we have any questions in the chat?
So we currently do not have any questions in the chat. I'm happy for folks to come off of mute and ask me. I don't even have any anonymous questions at this point.
Okay.
But I think it would be nice. You mentioned something a couple of times. What if, as people get there, health sciences raised their hand. Is that Marisette?
That's Marisette. Hi, Marisette.
Hi, Marisette. Please ask your question.
Oh man, cool. So my question really is, and I guess because this is on my mind, I'm sure it's on most of our minds, When you are in the middle of a community health needs assessment, and I'm going to use food insecurity right now, as we know that there's the potential for a hold on SNAP benefits and food stamps, et cetera, and you're in the middle of something where you're doing something on food insecurity, how does that impact the collection? And I'm going to use that specifically because that's kind of where we are right now. How would you see that in any other situation impact how you're collecting data? And you're in the middle of something like that happening right now statewide, potentially happening.
That is a great, great question. And I'm just going to share my thoughts, and I'd be open to hear anyone else's thoughts about it as well. So, this is a sentinel event that we're dealing with right now. Let's hope. And so, that I think acknowledging it and looking and talk and thinking about using qualitative methods to talk to folks about the impact of that, this in some ways is timely, right? We can't ignore it as part of this community health needs assessment. But I also want to say that if this is a sentinel event, we need to recognize it as that and know that, how do I want to frame this? That this may be just a blip on the screen, but it can't be ignored, I guess is the best way to say it. And so if you're conducting a needs assessment and you're asking questions, you might want to ask them, so what is the impact of this on you on you personally? And how is it different? Because there's people right now who are all, the folks that are having their SNAP benefits, they're already struggling with food insecurity. How is this making it even worse for them? Might be a really great question, because you could get some really good, rich information to think, okay, what is our role in the community to address when we have these types of sentinel events? And also, what do we need to be thinking about how we currently address the issue when we don't have these sentinel events to do it better, if that makes sense?
Oh,
So,
I love that, Pam. Because I think of the trickle effect. We often hear the term that food is medicine, right? And so if there is insecurity due to this sentinel event, I love how you frame that, then that impacts, how someone's diabetes medication is going to impact them in terms of their medicine that they're taking.
yes,
How is that I mean, there's so many ripple effects to and I don't think people really drill down on that. Well, we're just putting it on a pause, but that pause could really impact someone's health long term,
absolutely.
based on what's going on. And the ability to pivot and be flexible in the middle of that. You mentioned in the notes being flexible with the script. And I think that also is an opportunity for us as organizations to be flexible about pivoting when a sentinel event occurs. And it may not be what we were focused on in the moment, but now it's accelerated, right? And I think when you're trying to deal with communities, you can't ignore the elephant in the room, much like what you shared. We have to acknowledge it. And I think because we can get so caught up in what our plan is, what it is we're trying to do,
Right.
that we miss what matters to the people. What
That's
is
exactly
it
right.
that our community members are dealing with right now, aside from the fact that we've got this project we're working on? What is
Yeah.
it that our community members are dealing with, and how do we then incorporate that? So I really appreciate the framing of what we would need to do with that. I just came back from a C.A.R.E meeting in Washington last week, and Julie and I didn't know the other one was going to be there. I was there to do a workshop breakout on some CHW work that I participated in North Carolina. And and one of the big things, as I sat in on those sessions, that they underscored is really amplifying community voices and patient voices. And really, in planning a research project, for this particular PCARI stands for Patient Centered Outcome Research Institute.
Yep.
And so they really are looking at what are patients and caregivers saying, and are you co-creating what it is that you want to do? And I think when this seminal event, I know last week I got an email, and I'm sorry I'm belaboring this a little bit, but it goes to the point. SC Thrive sent out an email to their community partners listing where the resources were and explaining the potential pause that might happen with SNAP benefits next month, applications, et cetera, et cetera. And so it's also a call to action when there's a Sentinel event for us to pull in our partners. So I'm going to stop right there.
I love that you're saying this because we're actually going to talk about community engagement and why that's so important in this process, as well as the community health improvement plan. Because for example, our folks that are moving into their chips, how does this, what's happening today, we can't ignore it, right? I mean, we may need to think about, do we need to think about this as part of our chip? Maybe not. I'm not saying, but I'm just saying we need to really think about our CHNAs and our chip, especially being like malleable, like it can change based on whatever events or things that are happening in the landscape of today, that we can change them.
Love that.
Thanks, Marisette. Appreciate you sharing.
I know that was a long question, but I did have one quick thing that I think might be useful for folks. Pam, but you mentioned, data collection, data that you can't get from other sources. Don't put that in your survey, right? You gave a good example of that in one of our other sessions with some folks. And it was basically like, if it's in your EHR, I was just wondering if you could just go, sounds
sure.
great, but like, what do you really mean by that?
The surveys in the past we've seen where they'll ask people like, what chronic conditions or diseases have they experienced, or do they have? That's a question you don't need to ask them, because you can get that from your electronic health records. You can find out from your EHRs what are the chronic conditions in your community. So don't put it on your survey. What you want to probably know more about is like, what's making it challenging for them to address that health condition. And those are oftentimes more of our non-medical drivers, right? Like access to care or costs, or, I don't own a car, those kinds of things, or other issues, substance use, all kinds of issues that could be affecting them or creating that chronic condition. So it's not really like, that's exactly what, you want to avoid, is don't put questions on there you can get elsewhere. And honestly, like if there are surveys that have been done by other groups, go find out what they asked so that you're avoiding those questions, and see if they'll collaborate with you to share their responses from their surveys.
Thank you. I just thought that was like really hands-on important. Thanks.
Sure. All right, I'm going to keep us moving. The second key challenge we want to talk about today is ensuring that your data that you collect reflects your community demographics. So why does representation matter? So let's talk about it in the context of how, from a quantitative and qualitative data perspective. So first of all, in the context of needs assessments and CHIPs, we're not doing academic research, right? Like this is not academic research here. But what it is really ensuring that you're engaging the community and getting their input, and engaging the community so that all of your community, their voices are reflected, not just one particular demographic, on what the health needs are, what are our strengths in our community, in terms of assets, and then what are the priorities? What do we need to focus our time on in our community? So think about your goals that you have as it relates to developing your CHNAs and CHIPs. It's real important to think about how we balance quality versus quantity in terms of our data collection. So a lot of healthcare systems just conduct surveys for their CHNA. And I raise this point because I'm going back to my banana pudding, healthcare banana pudding recipes. There's a variety of banana pudding recipes, just like there's a variety of ways to conduct CHNAs. And so that's okay. But one of the things we've learned through our landscape assessment is that we get really hung up on having a really high number of surveys completed, right? So a real high number, a real high response rate, which can be hard to calculate at times if we don't know what our denominator is. But there's this real pressure, right? Well, the big thing to think about is, as part of your survey, you want to make sure you collect demographic data. And when I talk about that, I mean like race and ethnicity, sex, age, education level, socioeconomic status. The reason why it's so important to collect demographic data through your surveys is this. If you collect all of this data through your surveys and they only look like one demographic, like me, a white female in her 50s, then what happens is you have certain groups that are not represented, and that can really widen the gaps in health outcomes, because what happens is you use that survey data and it is to develop, it might be to design programs or initiatives or to fund community-based organizations with your benefit dollars. But then you may be missing all of these other populations in creating programs and initiatives that fit, that make more sense for them. So that's the key issue here in terms of making sure that your data that you collect reflects your community demographics. So everybody likes to ask, so how much is enough data? And so I've got some things to make you aware of. Well, first of all, we know surveys is only one method for collecting data. So you can go back to the slides and look at the ones around collecting qualitative data, to put in other kinds of methods, right, in terms of collecting data. For your surveys, you can, and not just your surveys, but even other data collection methods, you can use a sample size calculator, and you can find these online, y'all, to help you figure out how many surveys you need that will make sure that it's representative of your community and you feel like it's true results. And this will be based on your population size. So get this. You don't really have to get as many surveys as you think when you're calculating your sample size. This is something I've learned in academia when I look at randomized control trials, talking about it from that perspective, like that sample size that's collected, for whatever research study is actually not really as big as you would think would be. Sometimes it is, but a lot of times it's not. And so for this example, if you had 50,000 people in your community, 500 may be sufficient if it reflects your community's demographics. So again, hitting this target does not mean your data is representative if you have certain groups that are unrepresented or underrepresented in your data. So how do we make sure that our data is representative? So first of all, you got to know what your community demographics are, right? And you need to compare your survey results to your community demographics. So let me just show you what you can pull out of the Census Reporter. So the Census Reporter is part of the American Community Survey, and this data is actually from 2021. It's Greenville County, and this shows you the median age in 2021 was 38.5. And if you look at the range, you can see it's fairly even, right? Through ages 0 to 69. And then you see a slight drop off on the age range of 70 to 79 and then 80 plus. We see that in Greenville County, 51% identified themselves as female, and then race and ethnicity, 65% identified themselves as white, with 16% as Black and 12% as Hispanic. So this is kind of the data when we're collecting our survey responses. We would want it to be similar as possible to what we're seeing here on the screen. You can also look at median household income, and as you can see here, it's broken down about in thirds for under 50K and 50 to 100,000, and then around a quarter make 100 to 200,000, and then about 11% are over 200,000. And then we see that 11.3% of individuals were below the poverty line. So these are the types of demographic data we're talking about that you can go find out about your community and use that as a gauge for when you're conducting your survey to make sure that the demographics match as close as possible. So what do you do if it's not representative? So we have a few options that we're going to share with you. And the first one is weighting your responses. I would highly recommend, again, if you have an academic partner in the community, that to use statistical techniques to help you weight your data responses, or you may have someone in your healthcare system that knows how to do this too. But the reason why you can weight responses, that adjusts the survey data so that it's more representative of the target population, and by giving more importance to some answers than others. And so why would you weight responses? Well, it helps reduce the sample bias. When you have a sample that doesn't perfectly mirror your community's demographics, the weighting compensates for this by giving more importance to the responses from underrepresented groups and less to those from overrepresented groups. It increases the generalizability, so that idea of true results, we can trust this data, and it improves your data quality. So a quick scenario: say you have a survey that has 70 male responses and 30 female responses, but the target population is 50-50. So 50% males, 50% females. What you can do to balance the sample is the responses from the 30 females would just be given a higher weight, and the responses from the 70 males would be given a lower weight. And so when you run your final analysis, that will help reflect the desired 50-50 gender split, which gives you a more accurate picture of the population's view than the raw data would. So again, what we find is our surveys are not, the results from our surveys, the demographics are not reflecting. So it's really, really important to try to get it to reflect our community's demographics. So that's one option. Let's talk about a couple more options. Option two is to increase your low response rates by working with your community partners. Can you work with community-based organizations or other messengers to help increase the responses to your survey? So think about neighborhood associations, faith-based community, nonprofits, other health partners that serve certain patient groups, for example. Could they help you increase your survey response rate? So it's really targeted, right? Targeting particular community partners that might be working with those individuals that are underrepresented or unrepresented in your survey data. So that's another option you can do. Option three is you can strengthen your data. If you're only doing quantitative data collection through surveys, how can you supplement that through qualitative data collection? So get out there and conduct focus groups, conduct community listening sessions. For example, here, and we're going to give a bigger a case study when we talk about community engagement, about how Bon Secours St. Francis worked in terms of they wanted to increase responses from their Hispanic population. And so this is another way that you can increase responses and learn more from those populations that might be underrepresented in your data from your survey. So you can do all three of those if you want. Those are just some options for you to think about as it relates to really increasing, really getting information from all of the folks in your community so it best reflects your community demographics. Again, here's some more resources for you to help address this issue. Again, we suggest if you have an academic partner or someone internal to your healthcare system that can help you with that, that's also a great way to go. And we hope that these resources will be useful to you in your CHNA data collection process. All right, so we've talked about the importance of making sure that your data is representative of your community demographics. Katie, do we have any questions in our chat?
Sadly, no. No one has asked any specific questions here. However, I welcome them. I thought these were some great examples.
And that's all right. Maybe I did such an amazing job. All of their questions were answered, or we can always answer them later. So I'll keep us
Absolutely.
moving. Does that work?
Absolutely, please.
All right, let's do it. Okay. Our third and final key challenge we have found in conducting CHNAs is engaging the community. How do we engage them in our process so that they are represented and we're creating equity, we're creating trust and buy-in in our communities, and creating strong collaborations? So I always start in any project I'm working with that I am really looking for a diverse group to inform any needs assessments I'm conducting. I love this wheel. This actually came from the state of Connecticut, their state Department of Public Health. And I've used it here in South Carolina with a lot of our work, but it gives you a really nice kind of helps you really think about the depth and breadth of community representation that you could tap into in your communities to engage as part of your CHNA, not just in data collection, but also in identifying priorities and then also in SHIP implementation. But today we're going to really focus on data collection for community health needs assessments. So when we think about representation and equity, if that's what our focus is, we really want to think about how do we engage a wide variety of stakeholders in our CHNA process so that we make sure we're really reflecting communities' priorities, not just the healthcare system's perspectives. We need to take into some consideration to those community members that are most impacted by health disparities. So you hear the term persons with lived experience. How do we engage them as part of our CHNA process? And think about this. So a lot of times we may just get input through data collection, but that's really not going to help us really do the best that we could do in terms of complete representation of our community and creating equity through our CHNA processes. So here are some key strategies you can consider to make sure there's representation and you're creating equity. Think about who are those community leaders and members that you can engage, and you could engage them through your working groups if you have working groups as part of your data collection process for CHNAs. You could form a community advisory board. That community advisory board, as I mentioned at the very beginning, some healthcare systems will create a community advisory board, and they help inform and design the data collection process and the prioritization process. Marissette was talking about, her trip to DC and how do we engage community from the very beginning in our processes when we're conducting needs assessments. And lastly, how can they play a role in helping share data back to the community in town hall meetings or other venues? So that is a key role that is a great way to engage community members, is helping get the data back out there. We hear that all the time. People collect data from me. They ask me to complete surveys. They ask me to be a part of a focus group, but I never see the report after. I never hear what happens. So how do we do a better job of getting that information back out there? Creating community buy-in and trust is really, really important. And so when you engage community members as part of the process, they're much more likely to trust the process and see it as more community-driven versus healthcare system-driven. And this idea of shared ownership really increases the likelihood of successful implementation and sustainability of intervention. So working from the very beginning with your community is only going to benefit you once it's time for the community health implementation plan, because there will be priorities that come up that the healthcare system may not or consider themselves should not own, but you have those community partners that can own those issues and take the lead in terms of addressing them. And a lot of times those are those issues related to those non-medical needs, right? So what are some strategies here in terms of helping build community trust and buy-in? So first, and very important, is how do we engage them early? I've said that already. How do we engage them early on, and how do we engage them often throughout the process? How do we create decision-making processes where it's a level playing field? Everyone has equal decision-making authority. That's really important. People like to know, how is my voice being heard, and how is it valued as part of this process? So letting them know up front what the decision-making processes are, and also as much as you can, making it equal decision-making power. And then also practicing transparent and frequent communication. So not just engaging them, but how do we communicate them on a regular basis on what the process is? How do we engage them when we run into challenges to come up with solutions? Those are the things we talk about in terms of frequent communication and transparency. And again, we really feel like this will help you build long-term continuous partnerships that will last, that can be sustainable. So we heard that from the very beginning as part of the national landscape in the LIT review. That's where healthcare systems struggle the most, is creating sustainable, long-lasting relationships with partners. So how can we do that through our CHNA process? So now let's talk about cross-sector collaboration. So I presented the stakeholder wheel to you at the very beginning for you to really think about who are those folks that we can engage and have them sit at the table with us. I always like to say, go back and look at your previous CHNA. Like, what were those issues there? And are those some of the stakeholders or community members that we need to be involved in this CHNA? So we know that health outcomes are shaped by many factors. So are we engaging those folks that represent housing or education or transportation or employment in this process? Really important to engage from a variety of sectors so that we can foster collaboration and look for opportunities to share resources. And then honestly, you get much better, come up with much better solutions that are going to be more sustainable versus that Band-Aid solution when we engage community partners and get diverse perspectives as part of this needs assessment process. So some action strategies, which I've probably already mentioned, but one of them is you can identify by engaging community members, what do we already have in our community to address the issues? And then that can lead into what are the gaps. So having these multiple sectors participating from the very beginning really helps you with doing a comprehensive job of really understanding what are the assets we have in our community. It helps to develop shared goals and metrics. So what is my role as this community-based organization, or this as a faith leader, or as a neighborhood association in terms of addressing priorities that come out of our needs assessment and goals that we've developed through our implementation plan. And then it gives us the opportunity for ongoing collaboration for meeting, builds on ongoing opportunities for meetings, and also collaboration on other opportunities that may or may not be related to what comes out of the CHNA. Lastly, sustainable stakeholder engagement. So that's that long-term relationship, right? So having stakeholder input really grounds the CHNA priorities and action strategies in the community so that they're feasible, culturally appropriate, and aligned with what's existing as it relates to our community assets and with our partnerships. So thinking again about long-term stakeholder engagement, here's some action strategies. And this really starts to get a little bit into the chip, but important to acknowledge right now, so we have it in the forefront of our minds as we're developing our CHNAs and our priorities, is how we can align existing initiatives, right? All of this should not fall just on the shoulders of the healthcare system. So how do we work with our community partners to align existing initiatives? How do we co-design action plans with our community partners that's based on our asset planning to help address those gaps? And then it also gives us the opportunity to identify diverse funding streams. how do we pull, how do we blend or braid resources to really better address the priorities that we identify through our community health needs assessment? All right, I want to talk about a case study to wrap this section up. And this is one that Melissa has shared with me on her reflections, on her experience. She participated as an academic partner of Bon Secours St. Francis's Community Health Needs Assessment. And so she sent me some background information, which I've actually heard from her as well as Bon Secours when we interviewed them as part of the landscape assessment report that we did for phase 1. And what Melissa shared with me is that Bon Secours, is part of their area that they serve some historic neighborhoods in and around the Greenville downtown area that now have a really large Hispanic population. Bon Secours St. Francis created a very robust steering committee that was pretty diverse in terms of its community partners. It included sectors like academia, philanthropy, community-based organizations and nonprofits, faith-based community, etc. So their data collection process included both quantitative, where they conducted surveys for their primary data collection, and also quantitative data included data from secondary data sources that they used. But they also collected qualitative data. So they did mixed methods, and their qualitative data they collected through town halls and focus groups. They worked with a consultant. So they hired a consultant to help them with their data collection process for their needs assessment. Survey data collection occurred through multiple pathways. So they did both phone and they did by paper. And they also leveraged targeted data collection support through their community partners. So they engaged them to help them win the data collection process. With all of that happening, the healthcare system, Bon Secours, St. Francis, felt like their data collection did not provide enough information or was representative enough of the growing Hispanic population they were serving in the downtown area. So they decided they were going to supplement their surveys with additional data collection through a partnership with the local university that would help them identify the specific health needs of the Hispanic community. And this included quantitative data. So the academic partners stratified secondary data and also qualitative data. So they were conducting focus groups and interviews with the Hispanic community members and stakeholders who supported the Hispanic community. So this project was kind of really outside of their CHNA scope, but it was turned in as part of their federal requirements because it really helped inform their action strategies and other efforts to support the health needs of the Hispanic community in Greenville. And so they really took a minute to really think about, okay, we know that our survey data is not representing the Hispanic community that we serve. And so they looked at strategies and ways to help really understand and get more information from that community. So this is just one example that they did, or one example for you to think about how you can ensure that your data that you collect reflects the demographics of your community, and how you can engage your community members to help, or as part of the CHNA process. I also want to throw in one more example about Prisma Health. So they had a similar issue where they felt like the data wasn't really representative across the demographics, including sex, race, ethnicity, socioeconomic status, and age. So they decided to partner with Clemson University's Department of Health Sciences to use some advanced statistical modeling to weight their survey data to make sure that the sample was representative across the 7 counties that the CHNA covered. So again, if you have academic partners that you can tap into to help you with this, please use them. Okay, of course, I would not leave this section of the session without sharing some resources with you. So again, if you're looking for more information on how you can engage your community as part of the CHNA process, here's some great resources for you. And we tried to diversify our resources so it wasn't all just like an article, but it includes toolkits or it includes exercises or videos or articles. So I hope that you find these useful to you as part of engaging the community, helping you better engage the community in the CHNA process. All right, Katie, any questions in the chat?
No questions, but we did have someone who is very excited about the community advisory board idea.
Okay, great.
Using to hear that in the community. I think the person has to jump off, but I think that this is a nice promo segue into our December 3rd session where we need to kind of get into the nuts and bolts of like, it's a great idea to say, yes, let's create a community advisory board, but what does that look like? Who could potentially be on it? What does engagement really look like? What's the quality of that, right? So I think people are excited. Hopefully they'll be excited for the next session.
Fantastic. Great. All right. We are really interested in hearing from you about some key nuggets that you pulled out. So I'm going to turn it over to Katie to describe it a little bit more.
All right. It looks like we might be finishing up a little early. So please, if you do have questions, come off. Again, no dumb questions, but I'm going to share my screen. We're going to do another fun little Mentimeter. Let me make sure I've got it right here, friends. There we go. So what stuck, right? We got a lot of information from Pam today. You all will get the slides. You'll get all of those links with the specific resources in the slides immediately after this. But we want to hear from you. Is there a little nugget of information you're able to take away from today's meeting? Could be an action, could be a resource you're going to use, could just be, oh, I should really have looked into my EHR data before I started developing survey questions and duplicating that, right? Or I'm going to be more thoughtful in the future about how we're doing our community engagement pieces and making sure that you're using those nice guidelines that Pam gave you. Oh, I remember now what the difference between qualitative and quantitative data is. Like, we really wanted to take it back to those really good basics. So, oh, great. We've got a couple people entering their info. The stakeholder wheel. Hooray. Pam, can you say again, like, why you really like using that? Like, how you've seen that work well before?
Sure. I mean, I think it's very pretty comprehensive of the different sectors in a community and thinking underneath the kind of the buckets, like in detail, who would fit within that sector. And so it's very helpful. And it reminds me every time I go look at it, who should we be thinking about to engage as part of whatever needs assessment at the time I'm working on? Because I've worked on a variety of topical areas like traumatic brain injury, opioids, but like it just gives you a sense of who's in our community that we should consider that could be very helpful in terms of this, making this process more robust and create sustainable long-term relationships.
Awesome.
So this is great. So choosing your data wisely. You mentioned the stakeholder wheel, thinking about weighting survey responses and collaborating with academic partners. Good. I'm glad to hear that.
Awesome. So just a few nuggets. Hopefully other folks will be able to add those in. We're also, I see a couple folks jumping off. If you do have to jump off a little early, we've got some reminders and a couple little things for folks. But if you would please do the SurveyMonkey evaluation for this meeting, it would really mean a lot to us. Y'all know how important it is to get those survey responses, as we've talked about all day today. This is a super short survey. There's options for you to provide additional information, but just a couple, was this useful? We really want to know, what kind of questions do you want to see in the future? What kind of content in the future? You have the opportunity to provide that to us. So
Katie, how about I go ahead and switch back to my slides?
Yeah.
And I know you'll lead us into wrap up. Can you see my screen?
Absolutely. It looks great.
Right.
So if you go to the next slide for me, Miss Pam.
Okay, there we go.
Great. All right. So I've promoted a couple other times. Pam's mentioned a number of things, but we took this really great information about how to think about your data collection for CHNAs and get to the nitty-gritty of that. The next session, please save the date, December 3rd from 9 a.m. to 10:30 a.m. We'll have that the final webinar for 2025. And if you use your phone and do the little QR code up there, you can automatically add that to your calendar and allows you to RSVP so we can know how many folks to prepare for. Then you can also share that out with anybody else that you think needs to be at this event. It's really easy to share that code. So we look forward to talking to you about authentic community engagement with your CHNAs and CHIPs. So this is the piece that allows, and correct me if I'm wrong, Pam, but this is the critical piece that allows you to have better CHNAs in the future, better quality chips, right? And then that it helps with the cycle, because without authentic community engagement, without real conversations with the folks that you serve, you're not really going to get the quality of data that you're looking for, and you're not going to be able to get real answers that will allow you to create actionable plans. So thank you all so much for being here. We really hope you'll join us for the next one. And if you haven't already clicked on the link in the chat, you can also use the QR code here to quickly do the meeting evaluation survey on your phone. Again, that's super important to us, and we really, really are grateful for the people who are able to do that. And we also are getting a couple extra post-it note what stuck things in our Mentimeter finally flowing up. So please continue to enter those in. We are collecting them, and hopefully y'all got something great out of today from our expert, Pam. What's our next one? I think that's it. We really thank you for attending. We feel like this is incredibly important work, and y'all are the ones actually getting it done. So we want to do whatever we can to make you feel that you have what you need. So ask us, email the Alliance, talk to Landon, and I'll give it over to him to say thank you and goodbye. Thanks so much, guys.
Absolutely. I won't take long closing this out today. I just want to thank everybody again for joining us. And we will be following up with those slides and those resources. And if you guys have any questions about the broader collective impact and action work, please don't hesitate to reach out to me, and I'll be happy to talk to you.